Thank you everyone for joining us today for our August RR-CLaN seminar. And can you believe it? We're in the second half of 2026. Today I'm joined by Daniel Barry and Jen O'Neill, who'll present Excel Essentials Real-World Data Skills. But before I formally introduce Dan and Jen and hand the session over, I would like to welcome everyone and begin with the acknowledgement of country. We acknowledge the traditional custodians of the lands and waters where we work and live. We acknowledge the traditional custodians' living culture, their connection to country, and their contributions to the life of this region and the beautiful lands that you're attending from today. We pay our respects to ancestors and elders of the region and to all Aboriginal people past, present and future, and to any Aboriginal people joining us here today. Welcome. This is a gangbuster session and we've got lots of new faces joining us today, which is fantastic. So a little bit about who we are and what we do. The Rural Research Collaborative Learning Network, RR-CLaN, is a large consolidated network that spans both New South Wales and Queensland. In New South Wales, members include the 10 regional local health districts, New South Wales Ambulance, New South Wales Health Education and Training Institute, HEDI, and similarly in Queensland, members include the Research Collaboratives and Translation Centres and the Rural and Regional Hospital and Health Services. We'd also like to acknowledge that our growing list of affiliate members who kindly circulate our comms and promote our seminars far and wide. And thank you, of course, to everyone in attendance for promoting our seminars to friends and colleagues, as we've noticed that people are joining from other states and even internationally. So wherever you're joining from, a big welcome to you and thanks for joining us today. The ultimate aim of RR-CLaN is to provide people with high quality research education and training to healthcare staff, particularly those working in rural, regional and remote areas, but we acknowledge our seminars are relevant to all sites and settings. Our aim is to provide you with the education and training opportunities to build skills in how to use and undertake research to improve the care that you deliver. In case you've missed any of the RR-CLaN seminars or are keen to revisit any of the past presentations, you can do so by jumping on to our RR-CLaN YouTube channel, and I'll pop that channel link in the chat shortly. As with every session, we are recording today's seminar and we'll post it to our RR-CLaN YouTube channel shortly after. In keeping with that, please keep your microphones muted during the presentations, and if you don't wish to appear on the recording, please turn your camera off. We'd love interaction from everyone who's in attendance, so please feel free to ask questions throughout the seminar. And in the first instance, please direct your questions to the chat function, and Dan and Jen will endeavour to answer them. And if we don't get a chance, we'll open up at the end. And if we don't get a chance to answer all the questions, we'll follow up with in the email that follows with responses to your questions. But we look forward to hearing from you. I'd now like to officially welcome Dan and Jen, who will be delivering today's session. Daniel Barry is a data analyst working for Northern New South Wales Local Health District. Dan is a biostatistician and a graduate of the New South Wales Health Biostatistics Training Program. He has worked on a range of projects within health and currently works within value-based healthcare. Jen, she's an epidemiologist at the Australian National University. She's a critical care nurse and a graduate of Australia's Field Epidemiology Training Program, Masters of Applied Epidemiology. Her work spans critical care research, pandemic preparedness, and communicable diseases. There are no two people that I wouldn't think are better to deliver today's session on Excel Essentials Real-World Data Skills than Dan and Jen. Hand it over to you guys. Thank you.
Thanks a lot, Zoe. What I might do is steal the screen share off you quickly, and what I'll do is I'll be using presenter view, so I won't necessarily be able to see the screen. So if anything comes up, maybe let us know and we'll see whether we can accommodate it at the time.
Perfect, thanks,
so I'll
Dan.
just share this screen. Hopefully everyone's seeing it.
Excellent, that's coming through. Thanks, Dan.
Okay, perfect. Just bear with me for a second. Okay. So today's seminar's on Excel Essentials Real-World Data Skills, and the format of the seminar is a short presentation followed by a demonstration on how to conduct a range of frequently needed data cleaning, manipulation and analysis tasks. And we'll reinforce all of that with a live demonstration. That live demonstration is going to have Jen go through a series of tasks you might commonly do in Excel, and I'll try to talk to what she's doing as she goes, and we're hopeful that all of that will work well. This presentation has been a real collaborative effort, but just want to acknowledge that although I'll be doing the bulk of the speaking, the majority of the work on the preparation of the resources and the much more difficult job of conducting a live demonstration Excel is being done by Jen. And so there's quite a large amount of work that she's put into it, and it wouldn't have been possible to do this without her in the first place. The structure of the talk is going to be an overview, and then we're just going to talk at who we're kind of pitching this seminar at, why you would use Excel. We'll take a little side journey into AI. Then we'll talk about when not to use Excel, and then having ascertained that we want to use Excel, what the common pitfalls are, how to keep your data tidy, safety habits, and then the demonstration. Can everyone hear me okay?
Yes.
Yes.
Yeah.
Excellent. So the first thing we're looking to do is identify and avoid common pitfalls in conducting data capture and analysis in Excel. We'll show you how to set up a clean and well-structured data set. We'll look at using a small set of core formulas to summarize data. We'll show people how to create and interpret a pivot table, and we'll show you how to build a simple, clear pivot chart to communicate your findings. And we're doing this through a range of resources. So we've developed a synthetic data set, and we've developed a set of instructions that take you through how to reproduce the demonstration that we'll show here today in Excel yourself offline, and we'll supply all of these after the seminar. So who is this seminar for? So this seminar is for clinicians looking to conduct research who intend on or have started using Excel to support their work, don't necessarily have any formal training or substantial experience with using Excel, and don't have access to or experience with other data analysis tools. So one of the questions that we're keen to kind of answer is what place Excel has in 2026 in this space. The first is it's broadly accessible. So pretty much everyone has access to the Microsoft Office suite of products, and Excel forms part of that. It's familiar. The way that it is presented to you as an interface is much more easier to interact with than a lot of, for instance, statistical data analysis packages. So even if you haven't used Excel before, it's a lot easier to see how you can use it because it's got a lot of commonalities with other packages like MS Word and Outlook, etc. There's also a lot of support, which means there's a fairly low barrier to entry. Excel also works with a range of data formats and allows you to provide output data in a common data format that you'll see around the place a lot. And it's useful for collaboration. So when you use more specialized tools, it can be a little bit more difficult to collaborate because your collaborators may not also have access to those, whereas you can swap data and files in Excel and have other people interact with them pretty easily. It's also well integrated with other tools. So Excel itself provides integration with a range of other tools, and a lot of different data analysis tools will also have integration with Excel, specifically because it's so common. It's also easy to make attractive figures and charts. There's a lot of legacy systems that output data in a format that can be picked up easily with Excel, so it makes it easy to deal with them. So that's all the reasons why you would look at Excel in 2026. But the other big thing is what is changing in the AI space, and there's a lot of kind of questions around why you would learn how to use Excel when you could just ask an AI to do your analysis for you. Things changing rapidly here, and yes, there are a range of ways to use AI to analyse data. I've got a couple of slides on this. One of them will focus more on governance and privacy. So health data is sensitive and subject to a range of privacy legislation, regardless of where you are coming from. Today, the jurisdiction you're in will likely have privacy legislation around how you use health data. There's a range of different AI tools in place in different organisations, but one of the distinctions that you'll need to make if you're using AI is whether you're looking at an organisational AI or a public or free AI tool. So in New South Wales Health, we have access to Microsoft Copilot, but there's an approved approach to using that and a range of non-approved approaches. So you want to check your local governance and privacy rules. The biggest issue is to avoid pasting identifiable or sensitive information unless you've got a tool approved for that purpose. What you definitely don't want to do is paste a whole bunch of patient data up into public ChatGPT, for instance. So that's kind of the governance and privacy aspect to using AI. But the other key part is you need to understand how you're going to analyze the data yourself if you want to be able to validate the kind of responses that you might get from any AI tool. And so we'd suggest that some basic skills in Excel are really supportive of being able to do that. The question that you probably need to answer is not just can AI do this, it's also am I allowed to put this data there, and is the output from any AI correct? And that's going to be the situation into the future, I think, for some time. Basic Excel knowledge will help you to identify wrong formulas, missing rows, incorrect totals, and poor assumptions. And we'd suggest that AI can be as an assistant, not a substitute for understanding the data and how to manipulate it. One thing that people are increasingly doing is using AI to generate graphics. You can generate some polished graphics pretty quickly with AI, but a polished graph isn't necessarily the same as an accurate one. And AI can't always generate an accurate graph at this point in time. And quite often in trying to generate an accurate graph with AI, it's quicker if you have the knowledge to just do it in Excel yourself in the first place. So I've talked about a little bit about why you should use Excel, but there's also a range of cases where you may not want to use Excel. So if as part of your data management you need multiple people working on a data set, large volumes of data, audit or approval trails, or you're dealing with complex data structures, and or if as part of your analysis you need automation, change tracking on your logic or strict reproducibility, then perhaps you're needing to investigate other tools for your research. So Excel is technically limited at around 1 million rows of data, but performance of actually applying calculations within Excel tends to degrade well before that, and it degrades sometimes to a point where a spreadsheet becomes unusable. It's a clear limitation of Excel, and for instance, an example of where that gets applied all the time is in things like population level research with millions of rows of data. The other main area where Excel becomes unmanageable is ensuring that data is entered and managed consistently into Excel spreadsheets becomes difficult with large data sets and multiple users. Validation and change management using manual processes becomes tedious and time consuming. So some common pitfalls in interacting with data in Excel, and we'll have a look at a range of these in our demo, are things like sorting only one column. So that will break the relationship between your data. If one column gets sorted and the rest of your columns don't, then the data in one column no longer relates to the rest of the data. And it's a really easy way to introduce a whole lot of errors that are really difficult to fix if you don't pick it up immediately. Another pitfall is leaving hidden rows or filters on and then conducting some analysis on that filtered data set. This can cause formulas and filters to include data in your results that you don't see, which means you might be misinterpreting the results you get from your formulas. Another one is hard coding values into Excel formulas. So this leads to errors when the data changes and you don't necessarily update the formula. In a health context, an example of this might be that you might hard code a threshold score for a diagnostic or a risk assessment tool into a formula. But if the clinical guidelines change and therefore that threshold changes, unless you remember to go back to the formula and change the hard coded value in it, then your logic will be outdated and your formulas will be incorrect. And the last one we'll look at here is inconsistent categorization of your data. So an example of this, so this means that when you filter it, it becomes more difficult to manage to filter your data correctly. And an inconsistent category that we'll look at is something like if you were to record sex in a column as the letter M, but also as the word male, and the letter F, but also the word female, then you have multiple selections to pick up each of those categories when you're trying to look at males or females as a separate group. So a good approach to dealing with data and managing data Excel is to keep your data tidy. And what do we mean when we talk about tidy data? What we mean is each row is an observation. So if you're talking about patients, then each row is one patient. If you're talking about visits or appointments, then each row is one visit or one appointment. And each column is one variable or one question. Sometimes you might have a series of related variables, and the tendency, for instance, if you were measuring the same thing at 1 week, 3 weeks, 6 weeks, 9 weeks, you might want to, or you might be tempted to pack those into one column separated by commas. We'd advise against that at this as part of this kind of presentation, because that makes it harder to then extract that data and deal with it later on. And the last thing is clear and consistent column names. So when you're naming things, and as I guess a general approach, think about if you were to come back to that spreadsheet cold 6 months from now, would you still be able to know by looking at the column what the info contained within that column was? So some do's and don'ts that support you in keeping your data tidy. So use simple headers, no long sentences, keep consistent formats, numbers, text and dates, and we'll look at that in our demo. Use Excel tables, and we'll also look at that. Use data validation. We don't actually look at this in the demo, but what data validation can do is allow you to use drop-down fields in order to enter data, which means that you can use less free text. And the more opportunities you have to enter free text into data, the more errors you will have as a kind of general rule, and the more cleaning you will need to do if you have to manage those free text variables. Some don'ts. Don't merge cells. They make it hard to manage when you're trying to do anything subsequently. Don't leave blank rows and columns. This breaks up the sort of data series and it makes it easy to miss entire chunks of your data when you're looking to select things. Don't put multiple values in one cell, and we use that as our we used our example of clinical measurement for that. And don't rely on colour alone to convey meaning. And I'll expand a little bit about on this. Quite often it's tempting to highlight particular rows of data, a particular colour, in order to demonstrate some characteristic of those rows. The issue with this can be you can only use one colour at a time, and it's quite difficult in Excel to filter by colour, and it can be quite difficult to see the data through the highlighted colours. So if you really need to highlight particular rows of data, then what we'd recommend is create another column and then create some entries in there and filter on those. So for instance, if you wanted to highlight all the patients that have been admitted on a ward for more than 14 days, one solution might be to create a greater than 14-day stay variable and add an entry against that for the filter to pick up instead of highlighting. So some habits to be safe with data. First one is always make sure you're dealing with your full data set. The second one is to make sure that you have backup. So keep your raw data untouched and work on a copy. The third is to keep data in one continuous block, and that makes it much easier to always select your full data set. Wherever possible, avoid manual calculations. So use pivot tables and formulas wherever you can. Before you interpret any analysis, make sure you've checked for any filters. And standardize your categories with anything that can be standardized and limit free text. Lastly, save your versions as version 1, 2, 3, etc. This gives you how your spreadsheet might have changed over time. If you have access to some sort of version control tool, by all means use that. But if you don't, it's worthwhile saving versions, because if you have to revert anything, it's useful to know at which point that changed. And then you don't lose as much work if you ever have to backtrack. All right, so the next part of this is our demonstration in Excel. And what we're going to do is run through a range of those steps that we just talked about. Jen's going to share her screen. And what I'm going to try to do is talk to what Jen is doing on that screen. So bear with us as we get sort of started, and hopefully this all goes well. Jen, if there's anything that I kind of miss in the description, feel free to correct me or add anything as well.
Will do. Can you see my screen okay?
We can see your screen okay,
Yeah.
but I think you may want to turn your camera off, as it looks like there's some issue with your video.
Sounds good. I thought my camera was off. I've changed it now.
There you go. All right, excellent. Thank you, Jen. So first things first, what we're looking at here is an example data set that's been created from synthetic data. So there's no actual real data here. This has all been generated using AI. It contains a range of variables that might be what you would expect from a report, perhaps from a system tracking emergency department presentations. It's not real data, I think, and so, well, it's definitely not real data, and it's been presented for teaching purposes only. We'll supply all of this after the seminar. Before we do anything else, let's make sure that we are working safely. So to do that, save as. I'm going to save a copy of this as my working copy. And I'm going to replace that file. And then I'm going to create a tab with a working copy of my data. I'm going to rename the first tab raw data. And then I'm going to use the little green triangle at the top and make sure I've got all of my data. And I'm going to press Control C to copy it. And I'm going to paste the whole lot into my working copy, and then I'm going to zoom in on that so all of you can see it. So we talked about sorting errors earlier. So I'm just going to show that quickly, and the easiest way to do this is, having told everyone not to highlight data, is to highlight the data. So having highlighted this data, if I select this facility column and then sort it, I'll get a prompt from Excel to expand the selection. If I go through with that, you can see that I've sorted the data by everything up to and including triage category, but I haven't sorted everything from presenting problem onwards. And so the issue is now that all of these columns are disconnected from all of these columns. So that's issue one. We're going to have a quick look at the data. So we're going to have a look at our column names. And how we're going to look at them is create another tab, and then I'll just paste them, and I'll use this little transpose function. And I can see that one of those is blank, so there's an issue there. And I can see pretty well that I know what all of these column names are, and I'll be able to refer to them in future. So I know that this is the arrival date and time, that's the patient MRN, that's the patient linkage identifier, name, etc. So if there are any issues with that, I might rename the columns, but there aren't, so I'll keep going. But what I have noticed through that is that I'm missing this column H. So I'm actually going to go and get rid of it. And so now I'll have a look at how many columns I have, and I can see from this little count cell. So the other thing I'm doing is, if you hit Control Shift and the arrow keys, you can select a contiguous block of data at once. So I'm using that to pick everything up, and then I'm looking and seeing that I've got 20 columns. If I click in column A, I can also see how many rows of data have an entry in them. So I can see that there's 3,981. If I want to keep that somewhere for further reference, if I click on it, that'll copy to the clipboard, and then I can paste that in, and I know that my initial count is that large. So this kind of scan can give you the size and the format of the data and highlight some issues that you're having within it. Looking at this data, I can see a few other interesting things, and I'll point out a couple of those that we've left in. So you can see in row 26 that we have a blank row of data. So what I'm going to do there is use the little green triangle to select everything. And then I am going to look for my filter button in the data menu. And I can see that I've selected everything here. I can see there's hospitals A to F, but I've also got this series of blanks. So I'm going to get rid of those. And the way to do that is to select in the row numbers. And if I select those and then right click on delete, that will get rid of only those rows. And now if I hit select all, I should have a complete set of data without blank rows. And if I double check my count again, I've got 3,981 in the count. So that's number of selected cells that contain data. And I've got 3,981 rows. And I started out with 3,981 rows. So I haven't accidentally deleted anything yet. Right. So the next thing I'm going to look to do is convert my data into an Excel table. So what that will do is that will make Excel treat my data as one continuous structured block of data. So by doing so, that reduces the risk of Excel missing parts of my data. Having deleted all the blank rows and the blank columns, that's quite simple. All I have to do is go to the home menu and I go to Format as Table. I'll get a prompt as to which format I want. I'm going to pick this one. And then I want to click the button for my table has headers because I don't want these headings of facility, arrival, date, time, etc. to be picked up as Excel as my data. So I do that, and now Excel knows that it's dealing with one block of data, and there's a whole range of advantages to this. The next thing that I'm going to do is have a look through some of this data and show some ways that we might tidy up particular issues that we find in the data. So I happen to know that within this data set that we've recorded sex as per the example that we gave earlier in a range of different ways. And what we want to do is reduce those down to just female and male for the sake of this data set. In order to do that, we're going to select the column and press Control H, and that will bring up the Find and Replace menu. What we're trying to do here is just standardize the data. We don't want to change the meaning of anything. We just want it to be a standardized number of categories so that we can filter it appropriately. So what I'm going to look for is all of the entries for males that were coded as M. So I'm going to find M on its own and replace it with male. And how I do that is I click on Match Entire Cell Contents. If I don't do this way, what will happen will be that every M in the data will get matched and the value male will be put into it. So where it says male here, that would be male and then the ALE after it. So if I click on the Match Entire Cell Contents, that means that Excel will only pick up cells that only contain an M and then replace those. A safe way of doing this is to find the first instance and replace it, and then just check that that does what you want and that you've picked up the correct issue that you want to fix. And once you've seen that a couple of times, then you might replace all, and that'll replace every like scenario in the data. For brevity, I'll now do the same with F and don't do that, female, and I'll find next. Okay, that's picked up. I'll replace that one. That worked, and then I'll replace all. So I see the question about case sensitivity, and it can be. It doesn't have to be, but it can be. And to make it case sensitive, you would click on Match Case. That probably doesn't matter so much in Excel sometimes, but it might matter if you're taking, so for instance, you can see that this entry of male is in all caps and this entry of male is in sentence case, but Excel is only seeing those as the one category of male. However, case sensitivity matters in other data analytics tools, And so if you're exporting data from Excel and then picking it up somewhere else, that's where it might matter. For now, I've cleaned up that column and we've only got two categories, and I've checked it with my filter. The next thing I'm going to do is fix up some dates and times in my data. And so you can see in the arrival date time that we're looking at a range of dates in a particular format, but some are indented differently by Excel than others. And so that's an indication that something different is happening with those couple of cells. Another indication is if I filter it, a couple of those cells have shown up as being 2025, and then the rest of the cells have shown up as being a specific date with a time following it. And what's happening here is date in this column has been supplied as text, but a couple of these date entries have been picked up as dates within Excel. So dates and times in Excel are an interesting and challenging kind of thing to clean. There's two issues. Typically Excel sometimes doesn't want to recognize something as a date when you want it to. The other issue is when you don't want it to, it does recognize something as a date. So for instance, if I type 01/01, that doesn't necessarily mean I'm referring to the 1st of January, but Excel will make it refer to the 1st of January in the year that you're in every time. How to fix this? So what we're going to do is we're going to recode these problematic dates into a cleaned variable. So I'm also going to show one of the advantages of working in a table here. So if I just happen to add the same variable name and copy one, and I'm using an Excel table, it'll automatically change the other copy of the variable so that it's got a different name so that I end up with unique variables. What I'm actually going to do is call this one arrival date time C for clean, and this one can be arrival date time, and so I know that's my copy of the raw data, so that if I make a mistake in trying to fix this data, I still can start from scratch again. So the issue here is these values are stored as text. To make Excel store these as dates, what we want to do is use a couple of formulas, and the formulas we want to use is the date value formula. So to enter a formula in Excel, you hit the equals key inside the cell, and that'll automatically start populating a formula for you. So date value is a formula in Excel. I'll just highlight what it does. So what date value does is convert a date in the form of text to a number that represents that date in Microsoft Excel date time code. So when Excel recognizes something as a date, it stores it as a number with a format over the top of it that appears as a date, and I'll show you what that looks like shortly. All right. So that gets the date value. This one will get the time, and time value does the same thing as date value, but for times. I've got the right, oh no, I don't have the right. These are color coded so they know so that you know which column you're referring to. So I want them both from the same column, so I could see that I'd done that incorrectly because one of them color coded as red. Right, so if I enter that, I now get a series of numbers. So that means that Excel's converted all the text dates into numbers, and I get a couple of value errors. The reason I get those value errors is because I'm trying to convert text into a date, and this has already been picked up by Excel as a date, and you can see that it's being held within Excel as a number. So the formula converting text into a number doesn't know what to do when I've supplied it with a number in the first place. How I'm going to fix this is I'm just going to use an apostrophe, which forces Excel to pick up any of the content of the cell that follows the apostrophe as text, and then my formula will work. And then to get that into something a bit more meaningful than a string of large numbers, what I'm going to do is select the entire column, and then I'm going to click in Home and the number format menu, and I'm going to use a custom format of days, months, 4-digit year, hours and minutes. And why hasn't that applied? There we go. And so now I've got the dates. And now I can see that all of those have been picked up by dates as dates, because when I filter it, I get 2025 and 2026. I'm seeing a few comments as to we do certain things a different way. I won't necessarily respond to all of them. I might get to some of them afterwards, but what I would say there is Excel will let you solve your problems in a range of different ways. There's not necessarily a best way to solve every problem. But we're just showing some of the issues that might come up and one of the solutions to them. You may have better ones, and that is a-okay. Now, the next thing we're going to do is use our cleaned date. So we've also got this discharge date time, and we're going to use that to create a length of stay. And now that those text values are being stored as dates by Excel, sorry, there's one other step to this. This is now being held as formulas. That's okay because it'll display that way, but actually what you often want to do is take the content of the formula and paste it as values. The reason for this is if you want to do your calculations with formulas, but once they're done, if you leave formulas in and then analyze the data from formulas, if anything happens to any of the cells that the formulas reference, your data will break. So my example here is if I delete that column, everything now throws a reference error, whereas if I copy all of that and I paste it as values, the data there is exactly the same, but it no longer depends on this arrival date time. So if I delete it, it's still there. Now that Excel's got the dates formatted as dates instead of text, I'll be able to calculate my length of stay from my discharge date time and my arrival date time. Minus. Excel deals with date arithmetic by counting numbers of days. What I want is number of hours, so I'm just going to multiply this figure by 24. And again, you see the use of the table because it simultaneously calculates the value for every cell of the table at the same time. And then I'm just going to look at those quickly so I can see that the formula's gone the whole way down. And now I can look at that length of stay and see if my length of stay for all my patients is within the ranges that I'd expect. And we can see that it broadly is. It's half an hour roughly to a bit over 5 hours. And then I've got this one outlier of 27.92. And depending on what question I'm trying to answer, I might look at that as an outlier in my data. So now I'm going to do a little bit of analysis of the data, and I'm going to have to kind of scoot along here to get it all done. What we're going to do is have a look at the distribution of age in the data. So we're going to use the following formulas: count, minimum, maximum, mean, median, and mode. And so what we're going to do there is enter our formula, use the count, go back to our data, it's my age variable, select age, and that gives us 3,980 records with an age in them, and we know that we had 3,981 records including the header, so we know we've got ages for everything. I'm then going to copy this down, but what I'm then going to do is change all of the formulas to the appropriate formula for each one. And so minimum, maximum, and median are all fairly self-explanatory, but two that you might use frequently to look at any skew in your data are mean and mode. They're a little bit different. In Excel, the mean is the formula average, and the mode is the formula mode single. And so from this, we can see that the median's 45, the mean's 45. That may or may not mean that the data's kind of fairly evenly distributed. And the mode, which is the highest frequency age in the data, is 2, which is substantially different. Now, if we're wanting to look at statistics a bit more, holy dooly. Forgive me for the font size on this message, everyone, but that's a link to an excellent presentation by Dr. Alex Stevens on basic statistical analysis using Excel. So the last part of this presentation is to use pivot tables and pivot charts to summarize the data. And what these are is a fairly flexible way of providing summary tables within your data. They're pretty easy to implement. They're not necessarily intuitive, but once you've kind of used them once or twice, it's pretty straightforward from there to use them, and they're quite powerful, and they let you do a whole lot of kind of scenario analysis quite quickly. So they're a really useful tool to understand. So to create a pivot table, we select Insert and Pivot Table. That will give us a prompt. It will ask us for a table and range. We want our working data and we want all of it. So I'll just make sure that I've got all of that. And now we've got the shell of a pivot table. The first thing we select will pop into the rows of the table. And so what we're going to do with this is we're going to answer the question, how many presentations have there been at each hospital by triage category. So if we select facility, we now have a table with a series of rows, hospitals A to F. If we then select our triage category, that'll pop down into our values. That's not what we want. We want it in the columns. So you can see that we've now got an empty table with rows as hospitals and columns as triage categories 1 to 5. The reason it's empty is we haven't put anything in this values area yet. Since every row of our data is a presentation in this data set, we just need to select something that we know is complete, and then Excel will accurately count the number of presentations. And so something that's complete is MRN. So if I grab the MRN variable and drop it in values, we now have an answer as to how many presentations there were in each triage category at each hospital within our data set. And we can change that pretty readily too, so that you can pick any combination of these variables and summarize it really quickly. So this is raw counts of presentations. The other thing that I can show quickly is how you can then look at things like proportions. And so I'll show a couple of those, but if we're interested instead in the proportion of all of our presentations in a particular category, i.e. what percentage of all presentations are triage 1 at hospital A, then what I would do is look at show values as. At the moment there's no calculation. If I change it to percentage of grand total, then I've got the proportion of all. So you can see at hospital A, triage category 1, that's 3.49% of all presentations. If I then change that field, and instead of percentage of grand total, I change it to percentage of column total, I'm now getting the proportion of presentations in a particular triage category at a particular hospital. So now what I'm answering there is 16.73% of all triage category 1 presentations are occurring at hospital A. And I can do something similar by selecting the proportion of row total to look at what proportion of all presentations to hospital A are in which triage category. So the last part of this I'm going to do is show, and I see there's a lot of questions there, and I think we're going to have to take some of these questions offline after this. And I apologise for going a little bit over time or running into the end of the seminar. The last thing we'll do is create a pivot chart. To do that, we go to Insert, and the pivot chart is in Charts, but actually you need to select inside your pivot table first, and then select Insert menu, Pivot Charts. We're just going to select this clustered column chart. And I'm just going to take that and put that on another spreadsheet just to make things a little bit clearer for me and to let me make it a little bit bigger. So what we've got is hospitals by the proportion in each triage category. So the content of this pivot table is now being displayed in this chart. What I'm going to use it for is I'm going to use this chart to answer the question around how many lower urgency presentations, i.e. triage category 4 and 5, I have at each hospital. In order to do that, I have to shift the triage category from the series into the filters. And now I've got these raw percentages. If I change the value field back to no calculation, I've now got the number of presentations at each hospital, but you can see when I've shifted triage category from legend to filter that I've now got this little triage category filter up in my top left corner of my graph. If I now deselect triage category 1, 2, and 3 and keep only my lower urgency presentations for triage category 4 and 5, we'll see that that has changed the data substantially. And now what I've got is a graph of lower urgency ED presentations by hospital. And the last thing that I want to show you is I've got this visualization, but the challenge I've got is all of these little buttons in it. And if I want to get rid of those, I just click on the pivot chart analyze, and then I hide the field buttons, and I've just got a regular graph that I can present. The linkage between the chart and the table is that whatever is shown in the chart is also shown in the table at the same time. So this is just drawing from that pivot table. And if I look back to that pivot table, it now contains a filter for triage category with only triage category 4 and 5 selected, and only the counts of MRNs by each hospital. And that is the end of the presentation and demo. I will get back to everyone's questions at a later time, and I'll let Zoe get through the end of the presentation. But we got there. Thank you. Sorry, I've had to speed through a little bit. It's happened.
Thank you, Dan and Jen. And despite all the technical issues, you were cool, calm, and collected and did an outstanding job. It was so useful. I'm just going to share my screen. We won't be too much longer, and the recording will be coming to your inbox before too long. Just to flag, again, thank you so much, Dan and Jen. Just to flag the September session, it's going to be another great session, Mind the Gap, developing and using program logic models in health. It's not just restricted to health, though. Really, any project management of program logic model is super useful. So that's on the 2nd of September at 3 to 4, and I'll pop the registration into the chat. And lastly, thank you so much for attending. It was an awesome session. We'd love to get your feedback. We'd love to improve what we're doing and how we do it. So if you've got any feedback, if you want to tell Dan and Jen how great their session was, this is your opportunity. Please complete the end of RR-CLaN evaluation. We appreciate your feedback. Without too much more, thank you, Dan and Jen, for an awesome walkthrough of Excel Essentials and really just troubleshooting some of the things that we encounter. And I love the feedback throughout. People are going, aha, I enter that all the time. And now they've at least got a way to strategize and troubleshoot to make your data clean and get the results that you want. And the pivot tables were awesome. So thank you again. Thank you, everyone, for attending. And we look forward to seeing you in September. Have a good afternoon. Bye.
Thanks, everyone.
Thank you. Thank you.